Professor Peter Igba Udeme Sede, a professor of economics in the Department of Economics and Statistics at the University of Benin, has urged both state and federal governments to adopt fiscal policy to build growth and develop Nigeria's health economy, which will help reduce poverty and mortality rates in Nigeria. The professor made these remarks during the 375th inaugural lecture series titled Population Health and Macroeconomic Policy in Nigeria, held at the University of Benin's campus in the Ovia Northeast local government area of Edo State. Our government house correspondent files this report.
Nigeria is ranked one of the countries with the highest percentage of maternal, infant, and under 5 mortality by the United Nations. To curb this damning statistics, economics professor Peter Sede is asking the Nigerian government to invest in healthcare economics to foster socio-economic development across the 36 states and the Federal Capital Territory. He said governments must implement economics policies that will improve the living conditions of Nigerians.
Health outcome is very important in assessing the economic status of any economy, because a healthy population would ensure an economy where you have efficient allocation of resources, increased productivity, increased income, a competitive market that will increase the GDP of the nation. But when the economy is opposite, then we have what we call vicious cycle of poverty. Population health, therefore, is important because of its bearing upon productivity of an economy, the cost of living, standard of living, and the quality of life generally lived in that economy. And so, in assessing population health, indicators such as life expectancy, maternal mortality, and infant mortality, because of the weight they bear upon the already mentioned variables, are considered.
On its part, the Vice Chancellor of the University of Benin, Professor Edoba Omoregie, represented by the University Deputy Vice Chancellor Academics, Professor Victor Ogie Igbineweka, commended Professor Peter Sede for his excellent lecture series on population, healthcare, and macroeconomics, and urged the current government to implement the recommendations put forward by the economics professor in the day-to-day management of public administrations.
That fiscal policy should be adjusted to at least meet the proportions and uphold resource allocation standards to health sector as recommended by the United Nations and World Health Organization. He also recommended in the lecture that necessary macroeconomic variables should be employed to encourage monetary and financial attitude, such as financial deepening in Nigeria.
Will increase the life expectancy of humans and will also increase to the positive side of the gross domestic product of the Nigeria economy.
That life expectancy in Nigeria is low. Without being told, we know that. And he was able to statistically with figures demonstrate that Nigeria is the least among African nations, not even against the developed countries. Africa, that is sad to hear.
Population Health and Health Economics report shows Nigeria's crude mortality rate stands at approximately 10.5 to 11.5 deaths per 1,000 inhabitants. However, mortality indicators vary drastically across age groups. Young children and mothers face significantly higher risk than the general population in Nigeria.